All right, everybody, we're going to get started with our ambassador briefing all about engaging as ambassadors on the Safe Step Act, which reforms step therapy. We're so excited to have you all here today to talk about some of the ways that we can really elevate our advocacy, amplify our voices, and share our stories to break down this very important barrier to care. Today, we have together with you myself, Julie Eller, the manager of grassroots advocacy here at the Foundation. It's my job to help work with all of our volunteers to share their stories with their decision makers, like their legislators in Congress or at their state houses.
Hi everyone, I'm Stephanie Livingston, Consumer Health Specialist for the Advocacy team here in DC. So I work closely with Julie on our grassroots programs and many other projects.
She's a wearer of all hats. And we're really excited to talk with you today about ways that we can engage on step therapy. And we have an awesome team around the country who are here to help you as well. Our state directors cover different regions of the country, and they are equipped with all of the tools and resources that you need to engage locally with your state legislators. So as much as we are advocating in this particular briefing for some federal reforms, we want to emphasize that if you have not yet introduced yourself or worked with your state director in the past, to take down their name and their email, share your information with them so that they can look for local ways to help you share your story. During today's call, we're going to go through two components. Usually we do 3 different chunks of our briefing and focus on a lot of different areas, but today we're really going to narrow down our scope, dig into step therapy reform, and some ways that we can make a difference on this policy, on this issue. And it's a briefing we had just scheduled because we're so excited about the federal step therapy reform legislation being introduced just earlier this month. So we're trying to maximize on that, and we're going to talk about how we measure our success on this goal. So let's get right into it. Let's talk about the Safe Step Act, H.R. 2279, which helps to implement common sense guardrails around the use of step therapy imposed by health plans. Now, we've talked about step therapy a whole lot over the course of our time in the ambassador program this ambassador year, but if you're unfamiliar, step therapy is when your insurer denies coverage for a prescription that your doctor had written for you because they have an insurer-preferred medication that they would like you to try and fail before moving on to that doctor-prescribed treatment. And it can cause really lengthy delays for patients in accessing their care, not just patients with arthritis, but patients with any disease space. Step therapy does not discriminate based on your diagnosis. You can be experiencing step therapy for your diabetes or your depression or any number of diseases. And so it's important that as patients we gather together to share our stories about what happens when we experience any delay in care, and really so we can illustrate for our policymakers what this means for patients. So let's talk a little bit about that federal step therapy reform. We've had a real amazing opportunity to share our stories on behalf of the step therapy reform legislation a couple of times throughout this year. I know we have a number of people who were at our 2019 Advocacy Summit just last March who came to raise awareness and share their stories on behalf of this important legislation before it was formally introduced. So we were raising awareness, we were sounding the alarm at the Capitol to let our legislators know how important this legislation was and to encourage their support once the legislation was introduced. On April 10th, we had that bill introduction. So it was assigned a bill number and it was assigned a new name. We'll talk about this a little bit throughout our call today, but something that's important is that this is the second time that we've had a federal step therapy bill introduced at the Capitol. We have had last Congress, for the first time ever, we had legislation that was introduced to our legislators called the Restoring the Patient's Voice Act. This bill, H.R. 2279, the Safe Step Act, is an updated version of that same bill. So we have our same co-sponsors this year, Representatives Brad Wenstrup and Representative Ruiz, who are really championing this legislation on Capitol Hill. They're the same people who championed this legislation last year. They both happen to be healthcare providers, so they have experienced step therapy in their practices and with their own patients, and they are able to really bring that experience together in championing this legislation. So we have had our advocates at the Capitol at the Advocacy Summit, and we've also had a lot of opportunities for our advocates and our ambassadors to send information to members of Congress about step therapy since the beginning of the year. So just last month, our ambassador assignment was our Welcome to Congress assignment, where we shared our federal Leave Behind material from the summit with our legislators one more time to introduce them to all policy issues that are important to people with arthritis. But in that assignment, we all spotlighted step therapy reform as our primary call to action for this year. So as we talk about this next assignment, I want you to think about that past assignment that you completed, the past letter, and how you can use this as an opportunity to circle back on it, to say, hey, thank you so much for hearing me out when I said this the first time. Now we have an action opportunity. Now we have a bill number, so we're not just raising awareness for it, but we're making a hard ask. We want you to co-sponsor this legislation. So let's talk about some of the ways that you can be incredibly informed about this legislation to help make your advocacy pack a punch, have the best impact that it can. So we have used precision advocacy as our phrase many, many times in talking about how we want to best engage as ambassadors. It's important that we know the answers to some questions to inform our advocacy so that we're asking the right question. As an example, if your member of Congress is already co-sponsoring the legislation, you wouldn't want to ask them to co-sponsor the legislation in a letter about this bill. Instead, you would want to reframe your message and say, hey, this bill is so important for all of the same reasons that you would have put into an ask, but instead of making an ask at the end of that letter, you would want to say, and I thank you so much for your support. When we don't do those things, it looks like we haven't done our homework, and it seems as though we are not really caring and passionate about this issue. So together, we answered these questions, and we can be more informed ambassadors. The first question is, where was the bill introduced? Well, there are two chambers in our legislature, the House of Representatives and the Senate. We have not yet had step therapy reform legislation introduced into the Senate. This bill is introduced into the House of Representatives, and it has a new title, an updated title. Now it will be called the Safe Step Act versus the Restoring the Patient's Voice Act, which it was last Congress. And if you wanted to shorten up that title into just a bill number, the bill number is H.R. 2279. When you think about how you want to package this ask and what you want to say, we want to say that our introducing sponsors are Representatives Raul Ruiz and Brad Wenstrup. And as we mentioned before, both of those members of Congress have experience as healthcare providers and can share that with members of Congress to help them know that this policy, this healthcare policy, which will impact healthcare providers and insurers and patients all through the spectrum, will be informed by two members of Congress who have seen it firsthand. And that's a pretty remarkable thing. The next question we have here is, which committee was this bill referred to? And that committee is the House Committee on Education and Labor. This is an important piece of information because the people, the members of Congress who sit on this committee of jurisdiction, will have a little bit of additional power to look at this legislation, make some changes to it, make it strengthen it, and make sure that our advocacy is incorporated into the legislation. So if your member of Congress is a part of this committee, you would want to use that as a part of your ask. We did mention before that last Congress, this legislation was the Restoring the Patient's Voice Act, H.R. 2077. And something that's exciting, something that we can infuse into our ambassador advocacy this session, is that in the last Congress we had 88 bipartisan co-sponsors of this legislation. This legislation was seen as something that, circumvented all political party animosity and got right down to the heart of it, right down to making lives better for Americans all across the country. And those 88 members who sponsored the legislation last year are really easy targets to get onto this legislation this year. Unfortunately, there's no automatic process that says that the 88 members who sponsored in the last Congress will automatically elect to become a sponsor this Congress. Instead, we have to complete our advocacy again this year to make sure that those members of the House sponsor this legislation again in this year. And we have some tools that we'll show you in a little bit that can really help you emphasize or really hold your member of Congress accountable to make sure that you know whether or not they're officially signed on as a sponsor just yet. So let's move through some of our dedicated precision advocacy questions that you can use as you inform your advocacy, as you take on and complete some of your background research to strengthen your ask. The first question is my member of Congress on the House Committee of Education and Labor? And we've included the list of members who are on that committee, not only in this slide deck, but also in your ambassador guide for this month. You'll be able to take a look there and allow that membership to inform some of your advocacy. We've paired in your guide not only the list of those who are included here, but also some information or a talking point that you might consider using when it comes to engaging with one of these members of Congress. Again, one of the things that's really important is that this committee will have the first swing at our step therapy legislation. So if you do live in one of these districts, really mobilizing the support from your community becomes all the more essential. Talk to your neighbors, talk to your friends, talk to the folks at the Walk to Cure Arthritis in your area, and tell them about this legislation and tell them how important it is that they raise their voice and share their stories. So the next question that we want you to ask as you approach your precision advocacy is, has my home state passed step therapy reform legislation? And I want to talk about this and just pause for a moment, because I know that we have been working really hard to advocate for step therapy reform at the state level and at the federal level. And for those of us who are working with your state legislatures to make sure that step therapy reform wins are possible, we want to say thank you. We've had over 20 states pass step therapy reform, and that is no small feat. And this federal legislation would help to amplify those protections. In an ideal world, we would have every state have a step therapy statewide reform, and also this federal legislation to make sure that we are doubly protected, because these pieces of legislation work together to make sure that everybody, regardless of your plan type, are covered by these guardrails against burdensome use of step therapy. So if you have passed step therapy reform in your state, you can say to your member of Congress, hey, we are so excited that we have had step therapy reform passed at the state level, but we want to expand those protections and the patients that are covered in them. We want to make sure that every person in the state is protected by these same protections. And then with this federal legislation, these two bills can work, or these two pieces of legislation can work in concert with one another to really provide the best protections possible for patients in our states and in our country. The next question that you'll want to ask to inform your advocacy is my representative new to Congress? So we've had over 85 members of Congress, members of the House specifically, that are freshman members. And we talked a lot about this during our Welcome to Congress opportunity last month as a part of that ambassador call. We wanted to make sure that we introduced all members of Congress, but especially our freshmen, to the important policies that we're talking about as advocates. This is another time where we want to use that newness to our advantage, because we have the opportunity here to share with our freshman members the importance of making common sense patient-centered reforms to step therapy and how that'll impact their constituents and how that will really help them make their mark on this Congress that they're a part of. So you have this opportunity here to introduce them to you as a patient, to arthritis stories at large and give them this opportunity to help make a really meaningful difference by sponsoring this legislation. The next question that we have here is, did my representative sponsor the legislation last Congress? So in the 115th, when we had this first swing at federal step therapy reform, did my representative sign on as a sponsor? And we had 88 members of Congress sponsor the Restoring the Patient's Voice Act last year, and we have all 88 of those sponsors listed in your ambassador guide. So you can take a look and see not only who is there that is currently in Congress, but also if you are from a district that had a turnover, maybe your member of Congress chose not to run again, or maybe they didn't win re-election, you'll be able to see which of those people had signed on as a sponsor last year. And what I want to encourage you to do is think about how you can use that precision advocacy not only in your outreach to people who we're trying to get to sign up as a sponsor again this year, but for those freshman members who are inheriting districts whose member of Congress was a sponsor from the last legislation, we can really emphasize to them, hey, it's hugely important that you carry on this torch and protect our constituents the same way that your predecessor did. This legislation is important to people with arthritis, and that makes up a large part of your home state. You can hit them with that prevalence number from the CDC and let them know over 1 million people have arthritis or over 30,000 people have arthritis to really put that human face on this. So we want you to take a look at your guide, carefully look at the members of Congress who are listed here, take a look and figure out if you're inheriting a district of someone who was a sponsor last year who is no longer in Congress or who is. Because should that member of Congress have been a sponsor last Congress, that's hard to say, should that representative have sponsored the legislation in the last Congress, we want to be persistent and ask them again and again until they sponsor the legislation to sign up, to be our champion, to be a part of this legislation again. So those are our 4 key questions to inform your advocacy on this issue, and to, as you inform your own advocacy and working with Congress, to inform also the people in your community, to share with your neighbor, to share with the folks who visit your walk booths about why this is so important and how we can make a difference, how we can make that impact. And we've made a lot of progress so far. You may have taken action already and sent a letter to Congress through our Action Center. We're really, really proud of the work that has been done by our grassroots advocates across the country. You can see here in this map the density of who is sending messages, how many messages have been sent, and which members of Congress, based on their congressional districts, have been reached. And I wanted to share a couple of really awesome resources with you. First, you'll see here that over 700 letters have been sent. This is, I think, the second time that we've shared a map like this in a presentation where shortly after we've taken the screenshot to plug into the slide, we've had that number grow. And we know that we've reached more than 718, we had 718 letters sent to Congress on this important issue. And I want you all as ambassadors, as our stewards of this really amazing advocacy work, to be able to track this progress live and think about how we can expand the scope of our advocacy. So you'll see at the bottom of this slide this bit.ly link, bit.ly/AF-SAFE-STEP-MAP. And if you plug that into your browser, your internet browser, or if you save it on your computer, you'll be able to see in real time how many advocates are taking action. And something that you might consider doing, should you have a lot of messages sent to a member of Congress, you can click into any of these states and see how many letters have reached your representative. Right now, we've reached 309 of the 435 representatives in the House. We want to hit every single one of those congressional districts. We want to make sure every member of the House has heard our voices and heard our message. But you can use the information that's included in this map to inform your advocacy, to inform that phone call that you make, to inform that letter that you send. So take a look, and if you notice that you have a cousin who lives in Idaho or in Texas or in any of those states that have 0 messages, we want to encourage you to share the action alert at bit.ly/HR2279 SafeStep. Share that link with your friends and family and communities across the country, because we want to make sure that this map is fully filled up. And with this, I'm going to pass the microphone over to Stephanie for a little while to talk about some additional resources.
Great, thank you. So when you take a look at your ambassador assignment guide for this month and next, you'll see a lot of great resources and information and talking points and things like that. But there are a few additional things that we would like you to take a look at and share with the people around you. And that includes our April Advocate webinar from just last week. That's up on the Arthritis Foundation YouTube. So you can find that. It'll be one of the more recently posted videos. We have an exciting new Ambassador Spotlight blog that was about Katie Roberts, our Maryland Advocacy Chair, about her experience with step therapy and everything that she's doing to take some great action. And then finally is the bill landing page that's on our Action Center website that'll tell you everything you need to know about the bill and where it lives and all of that. And we'll go through those steps right here. Oops, sorry about that. So if you visit the Action Center at arthritis.org/Action Center, on the left-hand side there, you will see track legislation. You can click that, and then you can look at the featured bill. We've placed the Safe Step Act there for you to take a look at. You can also search step therapy in the keyword section if it happens not to come up, but it'll be listed under federal. So you click on that and click through again. Sorry about that. And you'll be able to see all of the information that you could ever possibly hope for about, about the bill. So you'll see Congress's summary of the legislation, and then whether we support or oppose the bill, and a description from us about what step therapy is, some different statistics you can use in your messages, why it's important to arthritis patients, and so on. And then on the next part, you can see who the current co-sponsors are, where it stands in Congress, who it's been referred to, where it's currently sitting, if it's waiting for someone to sign it or something like that. And then if you want to really dive deep, you can go to that congress.gov website and look at some more text and information on it. But this is a really cool tool that we recommend you use to stay up to date in between our ambassador updates and our briefings and things like that. So check it out.
And as you go through your advocacy, when you message over to your member of Congress and you give them a call and you say, hey, we need your help, we need you to sponsor this legislation, should they say, yes, I'd love to sponsor this legislation, you can use this tool to see who those co-sponsors are right now and hold your member of Congress accountable. You know right where it is. This is right on our advocacy at arthritis.org webpage. It's easy to find, and the only way for that co-sponsorship, for your member of Congress to be on this sponsor list, is for them to have made official their sponsorship. So if you were at the Advocacy Summit and your member of Congress said, oh, we are so interested in helping you get this legislation across the finish line, you let me know when it's introduced and I'll add my name as a sponsor. This is a really great way to say to them, hey, I saw that you weren't yet a member of this sponsorship list. I want to remind you about this important legislation, and our phone conversation or our in-person meeting and our letter that I just sent just a few weeks ago where you expressed interest in this bill. So this is your feedback mechanism. It's a great place to make sure that you are holding your member of Congress accountable and to always have an action opportunity. Should your member of Congress not yet be on this list, we know we have an ask to make. Should your member of Congress become a member of this list, we know that we have some thank yous to send. And something that we're committed to doing from our perspective is to send, whenever a new co-sponsor comes onto this list, to send out a tweet from the Arthritis Foundation that thanks them for joining this important legislation, but also to share that information with all of you so that you can also post it on your Twitter account, so that you can throw it on your Facebook, so that you can email it to your friends and shout it from the rooftops that your advocacy helped to result in this member of Congress putting their name on this list. So in your ambassador guide, I know I've mentioned it a couple of times, Shortly after this briefing, we're going to have our recording go live and our ambassador guide go live, and you can expect to see an email before the end of the week that includes all of this information. But your guide will capture all of the information that we talked about during our call today. We have our precision advocacy questions and our lists that you can refer back to see, all right, I live in a step therapy reform state, I know what my talking point should be, or I know what I should ask my member of Congress. We also include in your ambassador guide information about how to target or send your message. Ideally, if you have come to an advocacy summit and you have a personal relationship with a member of staff in your member of Congress's office, we're hopeful that you will contact them directly. But if you haven't yet collected that information, we do have the ability to target your member of Congress through our Action Center, through our legislator lookup tool, and the steps to message them there are outlined directly in the ambassador guide. So what happens after you've taken action, after you've completed this awesome opportunity? We have our draft messages and our draft phone scripts included in those guides. Once you've taken them, you've personalized them, you've sent them over to Congress, there's still one more step that we're hoping that you will do. One of the really amazing things about this particular action opportunity is that grassroots map that we were able to show with you just a little bit ago to see which congressional districts were hit, which ones we still need to make sure we connect with. When we take action outside of the Action Center, we don't have that same ability to track all of these individual action opportunities. So what we need from you is for you to report in your ambassador activities. And this is something that will really help you, especially as we get closer to the summertime and closer to the end of our ambassador year, so that you can be kind of held accountable in the same way that your member of Congress is. We want to know when you're taking action, what the feedback was. If your member needs more feedback or needs more one-pagers or something like that, we can help make sure that that message gets out there, but we need to hear about it. So when you take action, come to your ambassador reporting center. Same spot in the website, you just go right to this button over here, and in your Ambassador Reporting Center, you'll be able to click into the Safe Step Act, HR 2279's response survey, and when you come in, you can provide your feedback and share some information about this. And what I want to show you is next is something really exciting that I hope will be an asset to all of our ambassadors. So something that we've heard from you all is that it's hard to track whether or not you've submitted an ambassador report or you haven't just yet. You can't remember quite all of the things that you've done. When you submit your ambassador report, you will receive a confirmation email. And at the very bottom of your confirmation email, there is a link populated from Voter Voice. And I want to encourage you to click into that link. You'll see a copy of your activity report is included at the bottom of your email. This is a part of all of our confirmation emails. When you click this link, you'll come to a populated and private site that is generated just for you from Voter Voice. And you can see how many actions you've taken over the last year in your lifetime of history with Voter Voice. Let's take a zoomed in approach for a moment. When you look at the survey that you submitted, you have two links in each of your activity lines. The first is a link for the survey itself that you submitted, and the second is for the link of whatever it was that you reported in. So you can see here, if I were to click survey, I would be able to open up and see, I completed this thing, here's my response, perfect, I've already provided feedback. If I were hoping to send it to someone, I could click this link and say, hey, ambassador friend who lives in another state, I know you took action. Did you report it? Here's the direct link to do so. And you can have some time to hold your friends accountable just the same. But what's really cool here is that you can see all of the activities that you've done in Voter Voice. So if you've taken action in an action alert, that'll automatically come into this center. As long as it's associated with your email and your home address, your confirmation email will have a link that will take you to this pre-populated page. You don't have to do anything but take action to have a whole laundry list of links included here. The most important thing is that you take action consistently with the same email address over time so that we can make sure that we have all of these things included here for you. Something that else that's really special is that you'll be able to see exactly when you took action. So should you have sent a message about step therapy reform to one of your members of Congress in the past 6 months and you want to follow up with a more personal email, you can use this tool to click in, see, okay, I messaged them about this on February 22nd, and I can say to them, hey, I just wanted to follow up with you on my last email from late February about this important issue. We have some progress. The legislation has now been introduced, and we want to make sure that you know about it. So you can use that as a tool in adding some more precision advocacy to what you are saying and doing. The one thing that's tricky, though, is that if you're not taking action through a pre-formatted action alert, the only way for your activities to show up as a touch point, as something that we can track, is if you report your activities. So there's an individual report for every one of the ambassador activities that we've had go live this year. Take a look and report them in so that we can use our tracking to build those maps to say, okay, we know that there was an ambassador outreach on this day, and it was supplemented by 3 messages from our advocates, because that will be really meaningful to how we approach our members of Congress when we go to Capitol Hill and meet with them and supplement all of your asks. So that being said, report. And as you do so, please remember that the Platinum Ambassador requirements are all measured based on these reports. So we're looking for 10 regular ambassador activities, so the ones like the one we've been talking about today, 6 bonus activities, which are outlined in our bonus activity sheets, which are they were in our last newsletter, and they're also populated online, and a fundraising minimum for the Arthritis Foundation of $1,000 for the year. So take a look at all of this stuff. Take a look at our Ambassador Reporting Center. And 2 other quick things, then I'll open it up for questions. We have a really exciting hot topics discussion that's going on in our online community right now and in our online forum, all about insurance challenges. So everything that we've talked about with step therapy is an insurance challenge, and if you have any questions or you want to dialogue about it, our hot topics forum is the space for you to do that. We have experts responding to any questions that come in. Anna Hyde, the Vice President of Advocacy and Access, Heidi Barrett, Platinum Ambassador and Washington Advocacy Chair is on, and Christina Rieg from the Ohio Department of Insurance are here to answer any of your questions. I know that we are running close to our half an hour or over our half an hour, so I appreciate you hanging on the line. We do have 2 ambassador updates coming up soon. Our next briefings will take place on June 26th and on August 21st, so stay tuned for those. And now I want to get to some questions because I see some coming through. If anybody has a question about needing some clarification about becoming a Platinum Ambassador for this upcoming year, you can reach out directly to me and also to your state director, and we can populate that state director map again in just a few moments. Let's see. Another question that we have is, do you have a list of those representatives who have co-sponsored the past legislation? Yes, and it's included in your ambassador guide. We tried to really make sure that everything there would be included in your guide so that it would be a nice, easy activity to accomplish, even with these elements of precision advocacy. One question that I see here is about emails coming into Gmail or into a work account or into a volunteer account. How can I consolidate these so I've got everything in one place? What the best thing that you can do is to pick one email that you are going to dedicate to advocacy to make sure that everything is going to come to that one place. For this particular user, if you'd like to email me, I can tell you which of your email accounts you have taken action in most frequently. But the great thing about Voter Voice and in our Action Center is that whatever email it is that you choose will be saved in our system. And that email, you won't have to populate it every single time. It'll be there so you can click in, take action, and it'll be logged to your name no matter what. So the easiest answer is pick an email address and stick with it. And we'll make sure to help you answer any questions about what you've done on other accounts to make sure that it's consolidated. And the final question that we have here is, do the voter voice activities get automatically logged into that system? The answer is yes, they do, if you're contributing to an advocate activity. Our ambassador activities really primarily take place outside of our Voter Voice Action Center because they're supposed to be geared toward developing those personal relationships with your members of Congress. So if you are contacting your representative through our Look Up Legislator tool, a copy of your letter will be included in that reporting center that you can take a look at that's personalized to you. But if you're taking action by emailing your member of Congress or their contacts from outside of our system, you'll have to report that in so that we have that log. So those are all of our questions that we have time for today. Thank you, everybody, for joining this briefing. I hope that this precision advocacy lesson about step therapy reform will be helpful for all of you. You can expect to see a recording of this briefing and our ambassador guide that we've mentioned a handful of times today go live on our website later on today, and then will be emailed out to all ambassadors tomorrow so that everybody has what they need to take action and make their voices heard. So thank you so much for joining us. Thank you, Stephanie, for presenting, and we really appreciate all of your time, and together we can break down these barriers to care. So thank you so much, and we'll talk again soon.